Good morning everybody. We're on A5 North this morning to take an opportunity to speak to staff and thank them for the hard work that they're doing, and particularly in light of some of the compliment letters that we have. We often as a health board concentrate on what we can learn from complaints, but there's often a lot of learning we can do from the compliments we receive from our patients. But the most recent compliment letter that I received attracted my attention a little more than normal. And that was because unusually it came from a student nurse. Student nurses don't always write to me or share their experiences with me, but a staff nurse took her time to share what the student had written in a thank you card and returned to A5 North. What the student said was that when they first arrived and they were caring for patients with very complex needs, they were very frightened. And they really needed the help and support of their mentor. And they were talking about what a wonderful opportunity that they'd had whilst on the ward, because the mentorship had been really superior to what they'd experienced before. But they also said that that really stood them in good stead because they overcame their fears, they grew in confidence, they grew in strength to become what they now believe is a much better nurse than they had been when they arrived. And what that made me think about was how important it is that we all support one another to learn together, whether that be as a student nurse and a staff nurse, or that is actually about how we learn, for example, as myself, as acting chief exec at the moment. I've learned a considerable amount over the last 2 weeks whilst Adam's not been here. And I think we all need to recognise that we're learning and be confident and capable and not be afraid to learn and to change our practice, but also to work together as a team to do that. And this is what the student was saying. They said that they'd seen excellent multidisciplinary working, and how, although they were a student working for a short period of time in this environment, they were treated as an equal by all members of the multidisciplinary team. And really that's the way we need to be working, because we were focusing on putting our patients at the centre of everything that we do by working together to concentrate on what our patients need. I've talked a lot about learning, about the importance of learning from one another and learning together. But sometimes to learn, you need to concentrate on what we've done well, but sometimes we need to understand what we haven't done well, or the challenges that we're facing on a day-to-day basis. When I talk to patients and staff across all of the settings that we provide care, whether that be community, mental health, or in our hospital settings, what I do know is that one of our greatest challenges at the moment, particularly for nursing, is our staffing levels. We all know that there are some challenges around recruitment of nurses, and I'm delighted to be able to say that we've had some wonderful events recently that we've held over weekends, and we've been able to recruit over 150 nurses into the health board. We know that those nurses will be joining us at the end of the spring and early into the summer, so that we can increase our staffing to ensure that we do have the right number of people caring for our patients. But it is important that when we struggle with staffing, that we share that experience with our senior colleagues to ensure that we work hard to make sure that we've got the right staff to care for the patients at the right time. Patient safety always being at the focus of everything that we do. I've had the opportunity this morning to talk to patients about what it's like to be a patient in our organisation, and what they often tell us is it's pretty scary. When they first arrive in the organisation, they're not clear about what's going to happen, who's going to care for them, what type of care they're going to receive, and they trust in us to guide them along the path in partnership. Having had the opportunity to speak to patients, what's very, very clear to me is that we do care about our patients, and we actually work really hard to get it right for them, and each patient of course is very different. So on behalf of the board, I'd like to take this opportunity to thank you for caring for people and keeping people well.